Cutting benefits to those who are dependent upon a program is the wrong approach to balancing our Medicare issue. The chief problem with Medicare is the cost that Medicare prescription drug recipients are ending up having to pay, or that our government pays on their behalf. In 2003, the Bush administration negotiated a deal with our nation's drug companies that requires our federal government to pay retail prices for Medicare drug prescriptions. We all know that eggs are cheaper by the dozen, and with literally tens of millions of Medicare drug prescriptions, our federal government should be negotiating the very best price that is possible to achieve for the cost of those drugs. By doing so, we can eliminate all of the problems with funding of Medicare and not have to cut any of the programs for any of the recipients.
I'm also opposed to that proposal. It's not our seniors who are responsible for the financial crisis that we're in, and I don't want to make cuts that will impact their ability to get health care and to survive. And I agree with Representative Witt that we need to do what we've done at the state level in terms of reducing the cost of prescription drugs. We have a prescription drug purchasing pool here where we're using the power of buying in bulk. We absolutely need to be doing that at the federal level so that we get better drug prices and prescription prices. And we also need to be focusing on better rates of reimbursement for our physicians so that more physicians will take Medicare patients. It is not the responsibility of the seniors. I am not interested in solving this problem by balancing the budget on their backs.
I oppose the proposal too. Instead of pulling the rug out from underneath our seniors and most vulnerable at a time when it's difficult to find help anywhere else, let's look at better reimbursement rates for physicians. Let's allow Medicare to negotiate drug prices. Let's create a public option for Medicare Part D. And here's another one that may end up being the most important reform we could make. Let's move to better prevention for the young people in the country, for end-of-life care, so we can decrease the cost of medical care and over a longer period of time smooth out the bumps that we have with a system that is really quite expensive now. And in the end then, will be both less expensive, provide better care and better reimbursement for physicians.